pleasure to have you there, madam. So
Thank
nice. Wow.
Yeah, that's nice.
Uh,
Thank you.
So
Thank
I
you. Thank
Dr.
you.
Sandhu is a great inspiration for all of us,
Oh
I
no,
honestly, because from the
you.
time I came here 20 years back. One name which I first heard was there is one Dr. Sandhu in Salmania, who is I was waiting to see this great personality, and I met her only
No,
after a
no.
long time.
Actually, I've been in
And
Salmania for 36
yeah,
years, so naturally,
yeah,
you
no, no,
know.
no.
so
But then after that, the one thing which I admire most is where, however, she is occupied for any ICRF camp, you just have to give a call.
yeah,
Any
yeah.
medical camp, madam is there,
You, you,
presence is there. No?
you
Why
And
are
don't
also.
no,
You
no,
also
but
do the
no,
same,
no,
Doctor
but in front
Babu.
of you, I don't. I'm just a little person
No,
learning a lot
no.
from you because your
You. I
simplicity, the
feel I
way,
learn from
no,
you.
no, madam.
Doctor, the for a cancer care group program and ICRF medical camps,
Uh,
we used to go, me, Salim, and Rajivan, we go to Panu Garden and pick Dr. Sandhu
yes, yes,
to the camps.
yes, yes, yes.
He's very punctual and I think, Doctor, can we start? So, Doctor, we are going to start now, right?
Yeah, I leave it to you. As I said,
Yeah.
all left to you on how you want it.
So, good
I,
evening to you all. Yeah. Good evening to you all. Thank you very much for joining our Lights of Kindness 20th session, which is a special session today. Our Dr. Babu Ramachandran, he joined us today, and our Dr. Sandhu is here, and our brothers and sisters are here. Once again, we welcome you all for this wonderful platform. And to begin with this session, I would like to invite our sister Vaishnavi to give an introduction about Lights of Kindness and our guest speaker of this evening, respected Dr. Babu Ramachandran. Thank you so much.
Good evening, everyone. Kindly note to be on mute while the session is going on, a sincere request. So let's start. Good evening. Kind greetings to one and all. Before we kickstart today's wonderful session, let me give an introduction to what Lights of Kindness initiative is about. Lights of Kindness Social Assistance Drive is an initiative founded by a few generous brothers and sisters to help and support those who are in need. We officially launched our activities from the 1st of March 2020 as a community support drive to provide aid from the hardships of COVID-19. Our initiatives include distributing dry ration, snacks and fruits, water, bus traveling free good cards, hats and safety materials to low-income workers. Furthermore, we organize COVID-19 awareness sessions which are taken by internationally known field experts. Our initiative is an active participant in blood donation camp and provides much needed medical assistance to those in need as well. We nurture our community by conducting youth development, talent programs, and awareness sessions. By virtually organizing free spoken English classes for low income workers, answering queries, and guiding workers traveling back to countries, we continue to grow and extend our hand for all those needy ones. A warm welcome to all those who could join us today and contribute to our noble cause. Now, I would like to introduce our guest speaker of this evening, Dr. Babu Ramachandran. With a postgraduate training in respiratory medicine, senior research fellow of the Indian Council of Medical Research, research on allergy and asthma, Dr. Babu Ramachandran has presented several papers at regional and national conferences in respiratory medicines. His paper on the research in the field of smoking cessation has been accepted at an international conference on substance abuse. As a quiz master, he has hosted quiz competitions at international, inter-school level as well as intercollegiate level in India and Bahrain. He has coordinated speechcraft programs for the employees of Bahrain Petroleum Company, BAPCO, Zain Telecom, and American Mission Hospital. Currently, he holds many positions of responsibility. From being a family practitioner and head of SAR Medical and Dental Care, physician head of the Community Outreach Wing, and the head of smoking cessation in American Mission Hospital, he is also the vice chairman of the Indian Community Relief Fund, ICRF, a wing under the Indian Embassy. Being the president of the Indian Medical Association, Bahrain, and on the member advisory board, Science India Forum, we sincerely appreciate his humble presence today. On behalf of Lives of Kindness and all of us, I request Dr. Babu Ramachandran to deliver his valuable presentation.
Thank you very much, Sister.
Thank you. Thank you, Mrs. Vaishnavi, for those very kind words of introduction. And first of all, let me acknowledge my gratitude to Mr. Saeed and the team behind these Lights of Kindness. I went through what they have done, and I did my own research into this and found that this team is slowly and silently working for the underprivileged and also for those who need support in various aspects with the onset of COVID-19. You know, this deadly pandemic which has overtaken our senses in many ways is now on the minds of everyone, be it children or adults. And enough has been said about the pandemic. So when Mr. Said asked me to speak about some aspects in this topic, and the suggestion came up to talk about e-learning and e-health, meaning basically what the present educational scenario is, how it has gone into a paradigm shift, and will we overcome this virus? Is it here to stay? And what are the challenges facing the students, the parents, and the teachers in today's world with the pandemic? This is what I would like to briefly touch upon. And I have timed my speech or my presentation of my talk, I must say. I'm not presenting with any slides. I would rather love it to be an interactive session where questions can come in and I can answer. Absolutely anything which I am comfortable with, I will answer. Otherwise, if I'm not able to, and it falls within my purview, I shall certainly get back to you with the answers soon or later. With those brief words of introduction, let me just start off on the education scenario today. I've got a couple of points which I have. See now, because of this pandemic, we are now faced with so many issues. The question of wearing a mask, social distancing. Well, when the pandemic started in China, nobody expected that it would come to Bahrain, India, or other parts of the world. But unknown to us, this silent virus has overpowered humanity and kept us in a net, I must say, in a sort of trap, if you can put it that way. But isn't this actually a way of nature getting back at us? This is something we really need to ponder. Because we claim that we have conquered moon, we have gone to Mars, we do robotic surgery when it comes to healthcare. From the world has been transformed into a global village where the information superhighway has virtually taken us by storm. And mankind thought it was the most supreme, till that tiny unseen virus locked us all in our homes. We were worried, we were flabbergasted. The medical fraternity itself was unaware in the beginning on how to come to terms with this disease. What did it hold in store for the people? Was it a real killer? It reminded many people of the pandemic of 1920, the Spanish flu, but the mankind overcame that. And then 100 years down the line, now this COVID-19 pandemic is here. But dear viewers, listeners, don't think it is here to stay. We will overcome it. And what we need for this is perseverance and a joint effort, and to always remain in a positive frame of mind. Because it's that positivity which is going to take us to the other end of the tunnel where there definitely is lights. There are lights at the end of the tunnel. And we have to move forward focusing on that. It has given all of us a chance to look into our own self, if I may be a little philosophical, to see the way of life we have been living, unconcerned about the environment, pollution, then the ravaging of nature, deforestation, everything was there. And the earth was going into a sort of, what would you call, an era where we felt that the seasons were being disrupted. And this earth, which was given as a gift from our forefathers, would not have been, and is even today, not in a position to, let's say, give it in a proper way to our newer generation. There are suggestions, as now Dr. Sandhu was saying, is it a biological warfare? There have been doubts raised that this was some virus which came in from China and so on. Well, without proper evidence, I or nobody else can say anything. But it has come in. It has come in a big way. It has killed millions. But still, it's not to be thought of as something which is going to last for years. It's something which slowly but surely we will overcome. Is vaccine the solution? It's too early to tell. See, I've been having several webinars with experts from different parts of the world, and everywhere the situation is the same. Economies have crumbled. Then people have lost their jobs. Anxiety and depression have taken over. Thus, it's all a mess. And there have been a lot of U-turns in the management of this disease. When the medical community was going in one way, then they realized this is not the way. They turned around and started in a different direction, trying to overpower this virus. And now we have it in a way under control. Definitely it's in a way under control. And that's because of all the research work, all the effort that has been put in, not just by the doctors alone, by the tribute, a big tribute to the society, to the community, to the paramedicals, to the doctors all over the world for the human service they're doing. Social service organizations came forward trying to help the thousands of people who have lost their jobs. There are so many cases of people who don't even have one square meal a day because they were affected by the pandemic. And as if I look at Bahrain alone, I must say there are many organizations here which have reached out to give people a shoulder to cry on and given them the necessary food materials to survive through this crisis. Anxiety and depression is another aspect which is plaguing the minds of people. But let's leave all those general aspects aside and focus on education. Just education alone. How has this changed the educational scenario, e-learning and e-health? What are the problems of this e-learning thing? You see, last year in 2018 and 2019 and even the beginning of 2020, children used to go to school. They used to interact with their peers, their friends, their teachers, and they had a jolly good time. learning and interacting. But then, when the sudden lockdown came, or when it became compulsory that children should not go out of doors, there was a pause for educationalists to think on what was the way. And then came this concept of, or the concept was already there, the adaptation of these e-learning techniques. You sit in your house, you sit in front of a laptop or a mobile phone. The teacher sits at some other part of the country and gives lessons. And the children have to learn those lessons, have to take it down. Initially, it was very difficult. But then, as with human resilience, students started to adapt to this. The parents started to adapt to this. The teachers have to adapt to this. Thus, the concept of e-learning slowly pervaded all sections of the student community, the parent community, and the teachers. But then, what are the issues involved in this sort of e-learning? I know many of you have many issues to discuss. You have your own suggestion. Please feel free to share those suggestions and the questions as well. I'm giving my viewpoint on it. Students are now in a state of not only students and adults are in a stage of what is now termed as pandemic fatigue, where they have enough of sitting indoors, where they have enough of sitting at the computers, eyes focused on the screen, 40 minutes class, a break for 10 minutes, again another 40-minute class, break for 10 minutes. Their interaction is mainly just with the screen in front of them. They don't see who is teaching. They don't have a personal view, a personal interaction with the teachers on the other side. And this frustrates the children to a large extent. But what about the plight of the teachers? Imagine the teachers, and I salute the teachers, the fraternity of teachers who have bounced back to teach and to impart education to the students, because theirs is a great problem. They have to prepare their lessons and they have to tell it over a computer or over a laptop without visualizing the reaction of the students properly. Imagine talking to a blind wall, a wall in front of you. You may be, and sometimes you may be able to see your students, sometimes you may not be able to see them. You don't know whether they're listening or not. So this actually tells upon the health of the teachers as well. Let's look at it in three ways. The effect this e-learning has on the health of the teachers, on the students, and the parents. First and foremost, the teachers. You see, sitting in a chair for 30 minutes, glued to a monitor, may be okay. But imagine sitting at a screen for 4 to 5 hours, glued to a monitor, with just a gap of 10 minutes in between. It's not a joke. It's easy to say, but it's very difficult for the teachers. And that's why I say that the teachers should be given due credit and due applause. Before I said, I'm just seeing some messages also. Yes, Dr. Sandhu has very rightly said, medical students cannot learn without seeing patients. Yes, madam, that's a very good point. But I will come to that after I finish about the general thing of the teachers. So the teachers are in a tight corner. They have to teach, but at the same time, they don't see the students. That personal touch is not there. And I've seen many teachers come to us, the doctors, with complaints of eye strain, back pain, and also a sense of anxiety. Anxiety on what the students are learning through these e-classes, on whether they're assimilating something, whether they're able to really absorb the lessons that are given by the teachers. You see, every teacher has only one aim: to deliver quality education to the students. And if that's not there, huh? Hello? Yes? Am I clear?
It's okay. It's
Yes, sir,
okay.
you're
Clear,
clear.
doctor. Very clear, doctor.
Very clear. No, I just heard a
Somebody
interruption.
raising hand to ask a question, I think.
Right.
Is there a question now? I'm
No
ready.
question, doctor.
Okay, fine. If there is something, Said, please let me know. So back to where I had stopped. So the teachers have this issue that mental satisfaction, the mental satisfaction of not being able to reach out to the students affects them a lot.
Doctor, you can now unmute and you can speak. Doctor?
Yeah, fine.
Yeah, thank you, doctor.
I don't know, did I lose you in between, or can I just stay back from where I stopped off? In the sense that you have muted everybody else. Fine. That's good. So what happens is the teachers, they don't have that satisfaction of teaching when they are on the other side of the screen, not able to reach out to the students. And what does this lead to? It leads to a state of anxiety, a worry. Am I doing the right thing? I'm not able to see the expression of the students. Are they really listening? I'm spending so much time trying to help them out. And this can cause anxiety issues. The continuous sitting posture at a computer can cause back pain, muscle aches, and so on. And then the vision, always concentrating on the screen, trying to teach others, can also be bad for the eyes, but the teachers are forced to do it. This is one major problem that the teachers are facing. So what can the teachers do about it? There is something that teachers need to understand, and that is that we are going into a new normal. And this new normal is where we have to adapt ourselves, adopt to the new technology, and then take it that way. Understand that you may not be able to do full justice as you were in a classroom, but still, with the sincerity you teachers have, you will be able to mold the students. You'll be able to help them become better individuals. So speak with passion and teach with passion, but at the same time, take some rest in between. Just in the break time that you have, I know that in the break time that you have, you're busy preparing for the next class. But that break time of 10 minutes or 15 minutes that you get, just go in for some deep breathing, look out and watch the environment, look at the beautiful scenic views outside, and then come back and relax and go in for the next class. If you have some back problems also, do some stretching exercises. When you adjust your monitor and the chair in which you are sitting, follow the proper ergonomics, where the chair is straight, your eye contact is perfect to the screen, and the light is also shining properly, so that you don't have to dim your eyes, or you don't have to focus your eyes too much and concentrate heavily on these things. So relax and take it up like that. So that will enable you to overcome the challenges in health that you teachers are facing. Let's now go to the parents. What about the parents? You see, parents are into a level of frustration on different ways. Earlier, what happened was parents could actually send their children to school, and for the next 5 hours, 6 hours, while they are in school, well, they could relax a little, they could go for the job and so on. But now With the children stuck at home, they have got a greater responsibility to look after the children, to see that they are properly attending to the classes. And this is not easy. The younger generation, I would not say it's difficult to manage them, but they need to be managed with love. And they need to be managed with affection. That way, you can tell them the importance of learning through the computer, importance of learning through the system that is in front of you, and educate them and make them aware that unfortunately we are in a situation where we cannot go to class. We cannot physically go to class. So tell them those aspects. Don't force them to keep on studying, studying, and studying. Earlier, parents used to say, don't watch the computer, don't go into your PlayStation for many hours. Now, this has taken a flip with saying, be on your mobile phone, be on your computer while the classes are going on. But that does not mean you should give the children the freedom to go into these games whenever they are free from the rigors of learning. After that learning period, after a class, when there's a 10-minute break, I've heard many students tell that those 10 minutes I would like to go on my PlayStation or on online games. No, dear children, if you're listening to me, remember, those 10 minutes are meant for you to relax, not relax again at the computer or the keyboard of computer games, but just to again enjoy the beauty outside, as I told for the teachers, to interact with your parents. Because after so long at the computer, well, what happens is you need some rest and some relaxation. Do that. Do that relaxation. And with that relaxation, you will be fresh for the next class. So bear that in mind whenever you sit for a class, and understand that the teachers are putting in a lot of effort to help you. If you have problems seeing what is on the screen, or if you are having problems hearing what is being said, tell your parents and get those aspects of technology adjusted so that you are able to listen properly, you are able to see properly, you are able to attend to your classes properly. This will help you. If you feel totally frustrated about not being able to go out and meet your friends, well, this you should understand is unfortunately the situation we are in. But slowly we are getting into a state where we have unlocked ourselves to a certain extent. You can be in touch with your friends. I would not say to be always on the mobile phone, but at least you can call them once in a while. And this is a time for you to sit with your parents, a time for you to be there, dear students, and actually interact more with your parents, with whom maybe you never had time to spend when you were busy with 6 hours of school and 2 hours of tuition. Parents, understand the children's frustration, please. And if you have any anxiety issues, because people do come and say, I'm anxious about the future of my child. How long will this go on? What about higher education? Don't worry, we will go it one step at a time. They say, yeah, take the apple, take the bite, one bite at a time, like that. Let's find out a solution for this problem. Let's find out what is worrying you. And if you feel frustrated, if you feel upset, if you feel that there is a sense of depression or so on within you, touch base with your healthcare provider who is there. In all parts of the world, there are healthcare providers for everyone. Get in touch with them, and then you will find a solution. I believe that every problem has a solution. And if there is no solution, it means that you are part of the problem. So bear that in mind when you go ahead. Social interaction too is a must for you parents. And that interaction, not just with your children alone, try to connect with those back home. If you're an expatriate, connect with those people back home with whom you have not been in touch and spend some time with them. That'll help you boost your morale. It'll boost your potential to face the coming problems in the future. What about healthy eating? Now there is no exercise basically because people are afraid to go out. No, you can go out, you can spend some time. I pity kids as they've lost their childhood. My heart bleeds when I see small kids wearing masks. Yes, Madam Dr. Sandhu, it's true, but this too will pass. The children will look at it after 5 years and say, hey, there was a time when I wore a mask, because the mask is not here to stay, but at least there is one aspect. We have learned to be more hygienic. We have learned the importance of social distancing, and we have learned various practices of healthy eating as well, because there are so many menu cards going around saying, what can you, this is the best thing for tackling the COVID virus. This is the best thing for preventing you contracting the disease. Lemon and ginger in the morning, lemon and ginger in the afternoon, breathing exercises, healthy food, vitamin C, vitamin D. The list of remedies suggested by Dr. Google, Dr. Yahoo, and the WhatsApp. People have become more health conscious. Another comment which has come. Yes, Mr. Mohammad Al Khan. People have become more health conscious. People have become more health conscious because they realize that we have to overcome this phase. And with all the information that is fed into them, they have at times become too health conscious. You don't need to be paranoid about being healthy. Healthy eating, of course, and exercise. No more people, by the way, I'm just sorry if I'm interrupting between because I'm getting some messages. No more people goes to hospital for just a simple thing. That's a good point that you raised, because people fear to go to hospitals. And I know patients who have called me and said, doctor, is it safe to come to the hospital? And I say it is safe to come to the hospital when you have an illness rather than sit at home, because almost all hospitals, at least in the Kingdom of Bahrain, are equipped with the facility to have proper sanitization. I would say that it is safer than going to a shopping mall, because all hospitals have the capacity to have isolation room for suspected patients and to treat the healthy patients in a different way. So they have segregated them. So if you have an illness, don't sit with the illness at home. You don't need to rush to the hospital for a small fever, a little cold, or a mild cough. But if it's bothering you, contact your doctor. And for that now, telemedicine has taken a big role. It was there earlier. Now it has gained more prominence, where hospitals have given the facility for telemedicine, where you can interact face-to-face with your healthcare provider, get some suggestions, and if necessary, you go to the hospital. But at least the basic things can be discussed with one another, and you will get a solution for that. Then you can take a call on whether you really have to go to the hospital for your blood test, whether you have to go to the hospital to collect your medicines, or is there anything to be done. So don't be afraid of going to the hospitals. That will be there, that scare will be there, but don't be afraid. Exercise. If you are unable to go out and exercise, at least exercise in your compound. Go around wherever there is open air. Don't go into crowded places, because crowded places are not really good at this point of time. Enjoy the fresh breeze outside. Go out, spend some time with some brisk walking, 30 to 45 minutes. And while you're doing the brisk walking, you don't need to wear a mask. You can just walk around very well and inhale the nice fresh air and then come back. Healthy eating. Okay, you can go in for some lemon, you can go in for some vitamin D, you can go in for some vitamin D, but don't overdo it. There's no point taking lime juice morning, afternoon, and night and spoiling your stomach. You'll get a lot of these remedies. Don't go in for that. Take all those advice that is given to you from non-reliable sources. Take those advice with a pinch of salt. And then you move forward. You move forward with life. Because you all should understand that all of us live only once. And if we live right, once is enough. Life is not a bed of roses. It's a roller coaster ride. Take this as a downhill phase in your life. Take it in its stride. But be confident that this too will pass. Till that time that we have this too will pass, bear certain precautions in mind. You may have to wear your mask. You may have to have social distancing. And also, you'll have to wash your hands. Hand sanitization has come in to a great way. Because earlier, we were afraid of, we were not really, most of us did not take so much precaution or so much caution in washing hands, and we had forgotten the importance of washing hands. But now this has come in. But that does not mean you have to buy costly sanitizers and then wash your hands. Just a little running water and soap is enough. You can go get some good soap, wash your hands, and then move ahead. You don't have to wear a face shield and gloves and a full personal protective equipment when you go to the mall or when you go outside. A little bit of protection is good. You can wear your mask, and the gloves, if you're wearing it, will hinder you from touching your face immediately. It will hinder you from getting into contact with other surface. You will have some idea that you will have some, let's say, some feeling that, hey, it's not good to touch these with open hands. So the gloves helps you, and discard those gloves and discard the face mask properly after use. Don't just throw it anywhere, because that itself can spread diseases. So don't do that. There are lots of quality masks available. And now innovation has come in. Masks which are friendly with the environment, masks which help to prevent the germs from coming into us in a very nice way. You don't need to go in with a full, what we call as an N95 mask, which is totally sealed around, because it's not easy to wear that mask and go around 8 hours a day. But have the protection about the mask. I think I have taken around 30 minutes, more than 30, 35 minutes time. Let me just wind up with one sentence. You have to remember the 3 W's. WWW. It's not the World Wide Web. It is wash your hands, watch your distance, and wear a mask. With these precautions and a positive mindset, I'm sure in this era of e-learning and e-health, students, parents, and teachers, the 3 pivots of the community, can go for a better future, can see the children being molded into better citizens. Examinations, of course, they are there, and schools are modifying the way they have to write the examinations. Follow their instructions. Remember, parents and teachers, children are like clay. It's up to us, elders, to melt them with discipline, mold them with love, and shape them after us, their role models. Thank you very much to all of you. If there are any questions, Mr. Said, I am ready to take it.
Yeah, the floor is open. Thank you very much, Doctor, for your inspirational as well motivational talk. You encouraged us a lot. Your wonderful presentation, and we are expecting some questions or observation from our viewers, participants.
Good evening, Doctor.
Good evening.
Actually, I have a challenge, personal challenge with the
Yes.
wearing the mask. Actually,
Yes, Adam, tell me.
I get suffocated if I
Yes.
wear the mask in excess of 10 minutes. I begin to suffocate, so I have to take it off my nose momentarily, and then maybe under duress, I have to put it back.
Yes, Adam, what you say is true. You're not the only person having that challenge. There are hundreds of people with that challenge who get
Okay.
suffocated with the mask. But unfortunately, you have to adapt to it. There is no other way because that's the norm today. As we go into the new normal, that's what is needed. I cannot tell you don't wear a mask because of that, but at least if you're in an open space, you can just take out the mask, breathe well, and put it back. That's my
Okay.
advice to you.
All right. Thank you very much, doctor.
There's a statement from Gautam to everyone. I think this pandemic has brought out the need to speak about mental health more openly and remove the stigma. Very well said, Gautam. It's true because mental health is a very important aspect of our daily living. Most people have a stigma about speaking about mental health. They say, hey, if I go to a psychologist or a psychiatrist, will others think that I am crazy or I am mad? It's time to remove that stigma. Treat any mental doubts that you have. Let's not mental doubts. Any issues that you have about your anxiety or depression, treat it just like any other disease, like treating diabetes or blood pressure and so. Be bold enough to come out and speak to your healthcare provider. Get in touch with a good counselor. And there are people out there who can help you. Maybe what your parents or your teachers cannot tell you, a good psychologist may be able to guide you. You don't need medicines for that. And this is a passing phase. So that point about the mental health should be well taken by people. I do get a lot of calls because handling a helpline, me with several of us in the Indian Community Relief Fund, where I'm a part of, we do get a lot of calls about people undergoing depression. We meet them personally, motivate them, guide them. Because, and if somebody comes to you with a issue that they're being tensed up, don't just brush them off. Let them cry on your shoulder. Listen to them. That simple listening can prevent many people from taking the ultimate step to a suicide. Just remember that. Anything else? Any comments, any suggestions, anything which we can
Good
address
evening,
on?
sir. Good evening, doctor. Well,
Good
my name is
evening.
Mohammed.
Yes,
I'm
Mohammed.
from Lakshadweep, Minicoy.
Yes, Mohammed.
Well,
Good
on
evening.
Earth, there is a place, I don't know whether there is a place without COVID, and there is one place where I come from, Lakshadweep. We don't have
Okay.
even a single case there.
Wow,
But
that's
I don't,
actually.
thing is like, maybe we are geographically isolated from the entire India. We are in the Arabian Sea, right? So the government has taken a lot of precautions. But I still don't understand people there because the rules we are under India, we don't have even a single case. Still, kids have to wear this mask and go to the school. So it's not a question, but just a comment.
I understand, Mohammed. I understand your concern or what you're saying, but you see, an ounce of prevention is better than a pound of cure. So you never know if there are, because there are many asymptomatic patients, people in the community. They will spread the virus without having any symptoms like a fever, a cough, or a sore throat. You never know until you have everyone tested. So you can, if there are asymptomatic people walking around, would it be better that they wear a mask and walk around so that they prevent the disease from being from being contracted by them? But
Very
it's
true,
nice
sir.
to know.
Very
It's
true.
nice to know that Alan, there's no case so far. Let it remain that way. It will actually go down in
Because we
history
are
as a
taking a lot of precautions,
See?
very, very strong precautions, because prevention is better than cure. That's what we don't
said
have
it.
hospitals.
You said
We
it
only have
because
medical centers.
you said it. It's the precautions that matter. Maybe if the society, looking back, maybe if the society had been a little more conscious, this might not have spread so much. It's just a hindsight. It's not there. There's a question from Dr. Amajit, is it a man-made virus? Madam, it's very difficult to say. Those theories are there, it's a man-made virus, but politically and scientifically, I am not in a position to comment on that aspect. We don't know.
I think the time is going to running out.
Apart from everything, I was listening the entire. So I was listening the entire session, because I after a long day's work, thought of sitting and listen, because the way you were presented, it was really clear. Every point was very, very, directly to the point. We were able to understand, and even anybody who even doesn't understand English will also be able to understand, because your language is so simple. Maybe this is again a very strong blessing which I've seen in your session, sir. This is my comment, personal. And you have used very strong jargons and kind of usages, like rose, the confidence, about speak about the children. You said something regarding mold in them,
Melting with
shape in
discipline,
them,
yes.
like melt in them. Yeah, that was like superb, sir.
Thank you.
My
Thank
personal
you.
comment, it was really nice.
I agree the same. Very simple and very, very beautifully worded lecture.
Yes.
Thank you, Mohammed.
Each word had a meaning.
Yeah.
Thank you very much, Dr. Sandhu. And
Thank you, Dr. Sandhu.
I really want to add one more thing, sir. The session was thought-provoking. That's the last word I would say. It was very thought-provoking.
Thank you.
It will make people think. I have a request with the Lights of Kindness people to, send this recorded video to as many possible communities so that they can also listen. I personally request, sir, to Syed, sir, please.
Sure, we will do, brother.
I am truly humbled by the kind words that you have said.
Yeah.
Thank you.
Thank you.
And Doctor, can you wind up with the vote of thanks? Once again, I would like to invite our sister Vaishnavi to propose the vote of thanks on behalf of Lights of Kindness.
A sincere thank you for your very interesting and thought-provoking ideas on e-health and e-learning. It is my great honor and privilege to propose the vote of thanks on behalf of Lights of Kindness to our guest, Dr. Babu Ramachandran, for gracing today's session and delivering a concise yet informative presentation. Your gracious presence and ever available support for issues related to e-health has touched our hearts. I am sure that all the participants have taken note of your ideas and suggestions. My special thanks to the organizing committee, Said Sir and team for your unflinching support and coordination. Last but not the least, my heartfelt thanks to our fellow brothers and sisters for your active participation. With these warm words and a kind message, we move to the end of today's session. Thank you, everyone. Thank you for joining. Have a nice day ahead.
Thank you. Thank you, Said, once again. It has been my privilege and pleasure to be with all of you. And if I've been able to touch at least many of you, I'm happy. Thank you very much.
Thank you. Good night, Doctor.
Good night.
Thank
Good
you.
night.
Thank you.